You were going to the chiropractor, ART guy. He's just gonna check out my body, make sure, put me back together like Humpty Dumpty. Racing BMX, you gotta make sure that you have a good doctor. You gotta make sure you have a good chiropractor, because man, we get beat up. So we're about to go in right now, the Integrated Pain Relief Centers. Dr. Petrick, he's a chiropractor. He does active release technique. ART is a deep tissue technique. That's where it's kind of running my front just area as well. I took a digger at the last World Cup in Canada this weekend. It hit my shoulder pretty hard, so I'm gonna have him go in there and check it out and make sure everything's working in there.
With a high-level athlete, one of the things, the most important thing is not injury care, it's performance care.
Particular type of fibers that start to stick and adhere together, so they lose their elasticity. 5, 4.
You want to treat the athlete before the pain. Pain is a signal that there's a problem in the body. It's not the actual problem itself. When we started out with just doing some functional range of motion stuff, just making sure that the joint itself was stabilized. Then what we did was we went into some of the actual active release techniques, protocols. We checked the posterior shoulder, the teres major minor, some of the lat. We also checked some of the ligaments that actually hold the bones together in the shoulder to make sure that there was no ligamentous laxity or the shoulder was unstable in any way. Once we did that, we did some rolling patterns, to get the shoulder and open up the chest cage. Because when he fell on the shoulder, what ultimately happens is that he does affect the thoracic cage and the ribs. So we wanted to make sure that he doesn't limit himself again. Once we were finished with that, we did some adjustments to the spine, making sure that the spine was aligned. If the spine isn't aligned, he's going to end up with an abnormal wear pattern that's going to lead to abnormal muscle growth, which is going to lead to an abnormal asymmetrical athlete.
I've only had really one bad injury.
Yeah, I mean, we've had some heck. Dealing with a high-level athlete like Connor, first it's getting them to acknowledge the injury in itself, so that for a lot of times after the injury they don't want to be injured, so they won't let a doctor know that they're injured. So now that Connor's pretty much a higher thinker, he realizes that he can't perform at his optimal being injured. So our first thing is, how are they moving? Their functional movement. Do they have the normal movement patterns? Is there any aberrant motion or any changes from the actual injury or activity that's caused the problem?
If you have knots or bands or anything in your body that's restricting range of motion or restricting performance, he will go in there and work it out and help improve your range of motion and improve your muscular function. You didn't feel anything bad in there or anywhere? Okay, cool.
No, you're great.
Just impact stuff?
Yeah. Tightness. You definitely had tightness. You had some remnants of an injury or a fall. Okay. Connor was pretty much good. He should have 100% recovery with very limited, if any, repercussions from the fall at all.
Appreciate it. Thank you so much. Good to see you.